Patrick, what why is it going to be? What does it take to make someone successful in 5 days? And how we say how 5 days in Dallas can change your life.
I was just talking to one of the licensees there at the hotel outside when they took a break. And he was saying, this is just kind of wow. I didn't realize there was so much information in these 5 days. Now we're just halfway through the week, so he doesn't realize he's got a lot more information he's going to get. But I said, well, the great part is that we do call this a mini MBA. We give you a mini MBA in the medical revenue cycle management company process. But the good thing is we have all that pre-recorded already on our licensee website, which you'll have access to if you become a licensee. And Eric, I don't know, there must be over the past 7 or 8 years, we've probably posted hundreds of videos. So there's hundreds of hours of further information and training that you can get. Again, yep. All included in the license fee.
There you go. Well, Patrick, let me just ask this, for that live training workshop, what do you think one of the greatest takeaways that people will actually take away from that class?
Well, first of all, I hear this a lot at the end of the week. I did not realize that this market was so huge and that there was so many different things that we can offer to doctors that opens the doors and gets them in. Because let's face it, Eric, that's what a lot of people are scared of is how do I go out and actually get a client? How do I get my business going? Because they know that if they can get one doctor and do a good job for them, doctors talk amongst one another. In fact, we had Dr. Ratner show up today, be a go-to meeting there, and she says the same thing. She says, Patrick, doctors need help. They just don't know that they don't know, right? And so we teach them how to educate the doctors through some of the books that we've produced. The doctors get educated enough to call them up and say, hey, come do that pre-practice analysis that you talk about, and that's how we get in the door.
You bet. You bet. Well, I know one of the big questions that people have, Patrick, is, I may not have a background in medicine. I don't know anything really about medical billing. So the slide I'm going to bring up here next is talking about revenue cycle management. You mentioned that earlier just a moment ago. So what really is that?
Well, the revenue cycle inside of a doctor's office has to do with every aspect of what it takes for the doctor to get the money that's due or her. In other words, they do all this work seeing patients, they do all the procedures and so forth, examinations, shots, whatever, and they have to bill insurance companies and government agencies like Medicare to get paid. Well, that's the revenue cycle, but it doesn't just stop there. It also includes the payments from the patients themselves. Some of them are self-pay, some of them are paying out a balance at least. It's collecting the money up front, for the visit, the deductibles, and there's all kinds of other things that, again, it's hard in a webinar this short to go through all that, but that's what we cover in that week is the revenue cycle. And that illustration that you can kind of see there in that flyer that we designed for the licensee's use, it does explain that to the doctor, and they know this term, revenue cycle management. That is the term that they use as well. So this is no longer your mom and pop medical billing world, just like Lynn and I. My wife started this back in the early 80s. And we were doing it on a typewriter back then, even before, this is pre-computer days. So we've been around doing this, like you said, 24 years.
Yeah, and at the end of the training, you're going to get certified as a certified revenue manager. And here is a little bit better illustration that we can look at about starting what revenue cycle management is. And this kind of looks at how everything works. You start with a claim. You start with the submission. You're going to do claim management, obviously AR management, and then analytics, which is posting the payments. This whole cycle is what's called revenue cycle management. And the reason that we've got this illustration like this, folks, is for you to understand that most people, when they think of medical billing, is that yellow arrow and that orange arrow. That's really medical billing. But it's the rest of the blue kind of going to that light green, blue-green there. That's why we call you a certified medical revenue manager, because you're looking at the whole aspect of the doctor's money here.
Right. Well, that certification that's given, by the way, by the Medical Revenue Management Association of America. It's called a CMRM, Certified Medical Revenue Manager. Oh, he's showing you a certificate there that you get at the end of the week there. And so that is what you're certified as. So folks, you now can put letters after your name. If you don't have any, it adds great credibility on your credit card, your business card. Well, on your credit card, I guess it would help too. But it adds that credibility that you have been trained and certified. Now, will you know everything that you need to know when you leave the week? Enough to get your first client, but there's still a lot, there's other things that you can learn as well. So this is an ongoing learning process, and that's why we include unlimited training on an ongoing basis. See, you guys are here today. This is a Wednesday. We do these webinars on Wednesdays for people looking into getting trained by us. Once you're trained, you'll start attending those webinars on Fridays. So we've set that so, because Friday's usually a kind of a slow day anyway for medical offices at least. And you'll be able to watch those. We record them, of course. If you can't be live on them, it's okay. But you're just going to continue to get more and more information. It's just a wonderful business to be in.
You bet. You bet. Patrick, Chelsea is asking the question, if you could explain. I'm going to go back over here to the revenue cycle management slide there. And she was just asking, what does AR stand for? You want to kind of explain that real quickly, what the AR management means?
I have no idea. AR, what would that stand for? Oh, no, accounts receivable. So, folks, this is the money that's owed to the doctor. There is a process there inside of our system that does this automatically. Now, you're not have to call patients up or anything like that. This is all automated, but it includes the patient collections because, believe it or not, doctors bill the patients and only collect about 50% of that.
I know it. Now, yeah, that's something.
Huh?
Yeah. That's amazing. That really, really is amazing to know that.
I mean, no other businessman would put up with only collecting 50% of the money that's due them. But doctors do because they think, oh, well, I can just write that off at the end of the year on my taxes. Believe me, they'd rather have that money in the bank account. They can figure out other ways, not to pay taxes. Like spend money.
What a lot of doctors are doing right now, as they close out 2018, they're kind of looking back over 2018 and they're saying, I think I made the same amount of money as I did in 2017, but this year I had to see more patients. And folks, if you think about that, that's a problem. So that's why we're doing what we're doing. And just like Chelsea, who's asked that question about AR, there's other medical terminologies that we're going to teach you. So Patrick, again, we don't leave anybody, what we would say, behind. We really do get everybody up to a level of thinking about medical terminologies. What is a diagnosis code? What is a procedure code? What does CMS stand for? Which we can see it stands for Center of Medicare and Medicaid Services. But these are just some of the medical terminologies that we're actually going to go through on the first day.
Yeah, and so when we say that we by the end of the week we're certifying you, we're certifying that the fact that you actually now probably know more than 99% of all office managers out there about this business. And you'll be doing billing on the first day. We bring in the laptops, we set those up, and you're actually online through the cloud, connected to the internet connection there in the hotel, doing medical billing. By the end of the day, you've done several claims. And they're not real, go anywhere. Nobody gets paid on them, unfortunately. But you have had that experience, and you know at that point that you can do this business.
You bet. Absolutely. And it all starts with, again, on Monday, just kind of going through this terminology. And then obviously, Patrick, you and I have known, and you and I have been working at this training class and making sure it gets to where it needs to be, that, a long time ago, we decided to go ahead and just on the first day of training, just put people in front of laptops and get them understanding that they can feel comfortable, that they can do medical billing. And that's what you do on day one with iClaim, the iClaim training.
Yeah, you'll learn real fast, folks, that this is not brain surgery. Get it? That's a pun. You may be doing the billing for the brain surgeon, but it's not that hard to actually do the actual billing. But that's why we sell a license that's what we call a system. Get it? American Business Systems, because we want you to know it's already been tested and proven. This is like a franchise, but without the disadvantages of no territories are involved. You can sign up doctors anywhere in the United States. There's no royalties that you pay back to us, on the back end. it's just a fantastic model, and it's worked now for 24 years for people from coast to coast.
Yes, absolutely. And so, when we talk about a system, we've talked about American Business Systems, which are going to be all the services that Patrick and I are going to go through this afternoon, but kind of bringing it down from the clouds down to, the nitty gritty. Folks, the iClaim system in of itself is a system, and it services the doctor, it services that front office, and it also services you as the medical billing company. And that's very critical. Now, Patrick, I know a lot of people ask this question. If I'm going to do billing for a doctor's office, do I have to use this system, or can I just keep using their system and then still guarantee the same results that you're saying that iClaim can produce?
There's an old saying. I used to be a programmer back in the early days of computers. I worked for Apple Computer, and I can tell you that there are a lot of people out there who have heard this: garbage in,
right,
garbage out. So if you continued using the software that the doctor has in their office, you're not going to get the rejection rate that we get. Ours is like less than 2%, and
right.
Their system might be having a 20 or 30% rejection rate. So yes, they have to switch over to our system for us to do the billing. Now, on this screen here, you see the doctor is using EMRX. That's our private labeled version of an electronic medical records system. So the doctor is using that in the office. That gives them the ability to just, on an iPad, literally walk in and start talking to the patient and putting all the information in that needs to be there for you to do the billing on the back end. The front office has access to a scheduler, which is shown there. And so it's a perfectly integrated system.
You bet. And so what we're going to do, first of all, with you on that first day of training is to walk you through a demo. Now, Patrick, I just mentioned to everybody right before I brought you on about those that are on the webinar today that we need to encourage them to see our own demo, the same demo that they would see in the training class. And so you talk about a great way of getting a taste of what they're going to learn in that training class is to have a personalized demonstration with your business coach.
Well, and guys, think about this. We haven't gone into that in this webinar in depth, but in other webinars, we cover the fact that we do demos for your prospective clients. In other words, we get the doctor online using something like this GoToWebinar we're using here, and we're showing them live the system where they can ask questions. And by the way, that's us. That's our staff. That's not you. We're answering all their questions. And the goal, of course, is get them at the end of the webinar to say, okay, what do I do next? How do I get started? And Eric, about half of those doctors now are doing that.
Right. You bet. And half of those doctors do. As soon as we get through with that demo, they're wanting to know what they need to do to sign up. Now, folks, again, we're getting at about the 20-minute mark here. There's only been one question that's come in. So if you want to, feel free to ask us some questions. And until then, we're going to keep going. And Patrick, you and I have already talked about some hands-on training. So we're going to kind of teach them to have that hands-on training right there in the training class. Like we mentioned, we bring in those laptops. So, people do ask, can I bring my own laptop? Do I need to bring my own equipment there? I think we've got all that covered there in our training workshop.
Right. Well, we actually bring the laptops in. There's 2 people per desk or table, and we set that laptop right between them. One person gets to do it while the other one's kind of helping them figure out the information they need to put in. There's an example of one right there. And then the other person gets to put in a claim as well. And we go back and forth until everybody's just satisfied that, hey, I got this down. I mean, literally by the end of the day, you've done medical billing. You know how to use our system because it's the leading edge system that's out there. It's cloud-based. You can connect with it from anywhere in the world that has an internet connection. And people are just very happy at the end of that session.
Yeah, you're so right. I did able to shake out a couple of questions here. So let's go with Chandra. You asked the question, doctors' offices are already on an automated system like the EMRX. What is different about this one compared to the one that they are already using? You want to answer that?
Wow, where do we begin? All I can say, folks, is one of the huge advantages, of course, is that it is cloud-based. Now, doctors sometimes have systems in their office, but it's residing there on their computer. It's called a server-based system, and it doesn't give them the flexibility to check on their iPhone from the golf course and find out the status of everything that's going on in the office. Ours allows them to do that. But the biggest thing, I guess, is the fact that in most medical billing situations, you as the medical biller upload all of your claims at the end of the day to what's called a clearinghouse. That's a third-party company that scrubs the claims clean and reformats it for the way each one of the insurance companies wants to see it. They all want to see it a little differently. We have that already built in, folks. There is no third party. When you're putting the system in our system, it's done right there and then immediately sent to each one of those insurance companies that are out there. I guess that's the biggest thing.
Yeah, that is. And Chandra, I would say, if that didn't answer your question fully, please get with your business coach and schedule one of the demos. I think going through the demonstration will help you because, like Patrick said, the doctors already have some. Obviously, all doctors are doing billing. They're already doing scheduling. They're already using some type of EMR system. So why? Sure. That is why we offer you, as part of your due diligence, a demonstration of the system so that you get a clear understanding and the advantage that's there. Because, folks, if you think about it, most doctors have 2 or 3 programs that they're using, and they're trying to merge those together. And again, those that can cause major problems as we kind of go through it. But
this is why we offer to show you the demo live. This is just a screenshot here, but when we do it for you, we're really connected right over the internet to our system, and you're watching it in real time as we go through it and can ask all the questions you want. And if you're like most of the doctors and office managers who watch these demos, Eric, you've seen them say, wow. I mean, in the background, you can hear them talking, saying, man, I didn't know you could do that. And they're very excited about it when they see it because it is the leading edge stuff out there. It was designed and put together by 2 doctors. So they know what doctors want to see.
And the great thing about it is I've even had people who have had no medical billing backgrounds before. And whenever I go through them on a personal level, they're going, wow, I did not know that a system could actually do that. And that's what we're showing you real quickly right now is truly how easy it is to input a claim here. Obviously, these are just some screenshots here. But as you get going on this, excuse me, you'll find out that in the training class, once you've kind of got this process down and the system's doing so much for you already, it literally is you're going to create this claim, you're going to put all these numbers in there, and all of a sudden you're going to click on create claim, and you're going to realize, boom, that you have created a claim. But remember, that's just part of the revenue cycle management. All the other parts is posting the payments and making sure that the doctors are getting paid, because at the end of the day, Patrick, the more money that we can help collect for the doctor, the more money that I can make as a licensee.
Right, yeah, because you're billing the doctor a percentage of all the money that you're collecting. So if you collect $100,000 in a month's time and you're charging 7% of that, you make $7,000. And Eric, we don't go into it in this webinar, again, just for time limitations, but we've done others on exactly how much money you can make, how much time it's going to take you. It's just amazing how profitable the business can be. By the way, you see there on the screen a couple of codes there right about in the middle. And those codes, of course, everybody knows there's some kind of codes that they use for procedures and for the diagnosis. Well, these codes are all built into our system. You don't have to know anything about coding. No training in coding whatsoever is necessary because we've already put that into our electronic medical record system. When the doctor's using the iPad, like you see here illustrated, they are touching some buttons. They're big buttons, as you can see, made for an adult hand to touch and go through this thing. And it's, of course, cloud-based, all-in-one, certified by, HIPAA compliant and all that. And, of course, it's totally integrated with the billing system on the back end. So the doctor is putting in stuff on the front end, all of his notes and codes, and you on the back end are processing the claims. It's just man, I'm sure glad I'm associated with some company that has something high-tech like this, because Eric, my wife and I were using a typewriter, as I said earlier, but then when we moved to a computer and it was server-based, if we wanted to share any information with the doctor, we had to either upload some files to them or put a piece of software on their computer and connect with it. It's really clunky. With this, they can log in through their browser on their computer, and we can log in, log in, and everybody's looking at the same thing in real time.
Yeah, and folks, again, what's good about this is the capability of the system here, as we're showing you, the EMR system, or what's called electronic health records or electronic medical records, is that it is a platform that the doctors can use from like an iPad or an Android tablet or a laptop that has touch screens, that they can quickly get through these medical records, and then at the end of it, and because the system is already creating the codes for the doctors, that information goes directly into the iClaim platform. And folks, let me just kind of tell you a little secret. Within our system, because this kind of helps kind of answer the question earlier, why would a doctor want to change? When the doctors are using our system, the doctor can see a patient today, that claim be on your side to do the billing today. And because we are also the clearinghouse, we have the capability of getting that to the insurance payers the same evening, which means that, Patrick, we're seeing doctors get paid within 7 to 10 days versus 30, 60, or 90 days out.
Eric, we had one licensee that I interviewed that actually said we sent it on Monday and the doctor had the money in their bank account on Friday of that week. Now, that's not the typical, but even 14 days, 10 to 14 days, folks, that's quick. Some systems, 30, 45 days, 60 days in some before the doctor sees the money. So they love the fact that it's a fast turnaround as well.
You bet. And so part of the EMR training that you're going to go through is understanding that this EMR system can connect to all the major labs. So imagine the doctor can do all their radiology labs or blood work and just automatically get that over to any of their labs that they're using. And then the results actually come back into the EMR system here for the doctor and be able to get you notified quickly as a patient, and then get you that information even through another part of the system, which is the patient portal, which you will be alerted to say, go check your patient portal. Your lab results are already back in there for you to look that up. It really is so centristic or so centralized in making sure that the patient's needs are actually met.
It's the future. Folks, if you're wondering about any other system out there that's what I call server-based, remember that just means that it comes on a CD. There's software that actually loads into your computer there. That is so old-fashioned, you can't even imagine. Now, there are companies who sell their software on a CD, and then when you get it, they also tell you that, well, you can set up your own cloud if you want to. Yeah, if you want to pay thousands of dollars to set up and maintain a server in your office, which again, all the data is sitting right there. If it's stolen, you've broken all kinds of rules and regulations with HIPAA. So with ours, it's on our protected servers that are backed up nightly, that are redundant. We never have in 20 years lost any information. So it's just the ideal way to handle all this.
You bet. Patrick, Carl is asking the question is, how much is the total investment amount for the business opportunity?
$26,990. Now, folks, that's there's just one person, one seat for that license fee. If you want to bring a second person, it's an extra $995. So just round it up to $27,000 plus another $1,000 for an extra seat. And that's a one-time fee, folks. There are no royalties. You will never pay ABS another penny. Everything we do for our licensees is done because we have associations with our clearinghouse that's built into our system to get rebates on all the claims that go through the system. So we're making money on the back end, and we don't have to charge you anything for future training, extra seats, user seats at the software. You can install it on as many computers as you want. There's nothing to install, but you can log in on any computer. And you can have as many users. Issue users in the doctor's office. The office manager can have one. The biller can have another one there that's helping with the billing. You can have a doctor that has one. It's just unbelievable.
You bet. Claude, you're asking the question, is EMRX a separate service at an extra cost? Can the physician use iClaim without EMRX? The doctor can use iClaim without EMRX. And so that's a good thing. Right. There's some doctors who may want to continue to keep using an EMR system that they purchased. And sometimes doctors have, Patrick, we know they've spent $50,000 to $100,000 on an EMR system. So they're not so ready to move over. But when you start to collect the money for them and they see the benefits of having one that's already built in with their billing system, they're going to want to move over to that. And really the easeability for, as you can see here on this one screenshot, it really is a quick tapping through this to really get to what the doctor needs to get through to have what's called an encounter, and then finally get that claim over to you as a billing company to process that claim. Again, getting that claim from the doctor's office to you for you to do billing, and then you bill it and it gets to the payer today is something, again, in the marketplace, Patrick, there's no other software in the market that can touch what we do.
No, and I think you might have mentioned this earlier, Eric. I fall asleep sometimes when you're talking, so I forgot whether you said something about the eligibility. But that can actually, we can check in real time, folks. This is how high tech our system is. Literally, we can connect with the insurance company's database, and just by putting in the person's, their insurance number on the back of their card, it draws that information from the insurance company's database right into ours in real time, in seconds. And there it is, boom, you're looking at it. And so it saves a lot of time. You don't have to enter it in. Plus, the data is what the insurance company has on hand. So when you file the claim, it's going to go through. Oh, I'm giving away all kinds of secrets here, aren't I?
All kinds of secrets, which is great. I mean, people need to know that we're here to help them before they become licensees, because you're going to know this is how we're going to help you after you become a licensee. Rebecca is asking, or just saying she's driving. She's listening while she's driving. Can you send me the link where I can download it? We are recording this, Rebecca, so you'll be able to click the download here in another day or so. We'll get that to you so you can watch it yourself.
Hey, we also have the slides in the handout section. I don't know if you mentioned that earlier or not, but I see them there.
Yep. Got that there. So folks, let's keep going. Now, Patrick, once they get through Monday and Tuesday, which our group today has done that, and you've started the marketing process today. Part of that marketing process starts reviewing what other services that we have here. So you and I are going to kind of go through some of the services that they're going to learn over the next couple of days. And one of the services, Patrick, that a lot of people get a little nervous about is coding. You want to talk about coding? We have obviously already talked about that the EMR-X actually does the coding, but there are sometimes doctor actually needs extra coding.
Well, and as it says here, our certified professional coders, folks, we have over 100 certified professional coders on hand to do everything for you. So this is why you don't need to know anything about the codes. If the doctor even asks you about codes, then you can tell him that we have a service called CodeWrite. The CodeWrite service allows you to scan the doctor's medical charts into a coder's work queue here at our company, and they basically look at the data and then send a report back to the doctor showing all the advantages. I think we're going to show some here in just a second, some of the reports in addition to Audit Guard. But the point is, you don't have to know anything because we've already got coders who can do that for you. This is one of the services you can offer to the doctor for a fee, of course. But believe me, if he hired a coder inside of his office, he'd be paying $50,000 a year just for him to sit there and correct some codes now and then. We can do it all through CodeWrite.
You bet. And Audit Guard, as Patrick said, is still using those coders. And at any time, folks, a doctor could be under an audit from Medicare, from Aetna to United Healthcare. And what this will do, this will help unmask basically whether the doctor has been overcoding their charts or undercoding their charts. And what that means is, folks, is that when we talk about overcoding, that means maybe the doctor's getting more money than they should be, or they're not getting enough money as they should be. And the Audit Guard kind of helps balance all of that out. And the reports that Patrick was talking about here are these reports here that will kind of show where the doctor is, where they should be, and kind of where they should be with the other physicians that are actually in their area. So it's a really great service to help the doctor make sure that they're at least right on the right path with the codes that they're currently using.
Yeah, let me give an example of that. For example, let's say the doctor visits with the patient for 15 minutes. They do it in increments of about 15 minutes. So instead of billing for 15 minutes, though, their coding showed that the doctor visited for 30 minutes. Now, if Medicare sees that on a regular basis, they will know that something's going on. And when they do
Right.
the audit, they can fine the doctor up to $10,000 for every one of those codes that are overbilled. And like Eric said, sometimes they're undercoding because they're scared and they don't want to be audited, so they'll be undercoding. Right. They're leaving money on the table. If they really did and can document that they saw the patient for 30 minutes and did certain things to the patient, then they can bill for that and not worry about that. We can help them with this. By the way, these reports, we go through those with the doctor so that they understand them and can ask all the questions they want as well.
You bet, you bet. Bill's asking a couple of questions, so let me see if I can get some of these questions from Bill. Do you offer assistance / training on selling to the doctor's office? Bill, that's what we're doing right now about the live training workshop. That's everything that we focus our attention on, is to help you with that. And you asked, secondly, will all insurance companies accept claims from ABS? And they will, because we have to, as a clearinghouse, be able to send claims to all insurance companies. And just kind of give everybody for instance, the clearinghouse has been around for 20 plus years. So this is not anything that's new. That's what we would say latest and greatest, that we just got this started up here in the last year and a half or so. Folks, we've been working with this particular platform for nearly 8 years now, but it's been around for almost 20. So it's plenty. It's been used, and it's all these insurance claims are being paid by the doctors, or the insurance claims are paying the doctors through our clearinghouse. You bet.
Let me just touch on the how do we teach you how to sell? First of all, yeah, I even tell people who come to our training, if you have any background in sales, you might need to forget about 90% of it, because the way you market doctors is completely different than the way you sell anything else. So, folks, we don't have anything to sell. Let me ask you this. If you were out in the Sahara Desert and you had some popsicles, would you have to sell them? Well, we're selling money. We're telling the doctor we can increase their revenue and reduce their costs. There's nothing to sell. In fact, the way we do it basically is we teach about a dozen different ways that you can market to doctors. And you go out and basically your aim is to get what we call a practice analysis. That basically is just taking information from the office manager about the practice, putting it into our software when you get back to the office, and producing a report that shows the doctor we're either going to save them money or make them money or not. And if we are, then that's what does all the selling for you. So, right. Bill, you can relax. We've got the marketing side of this figured out. Now, when my wife and I started, all I did was just go out and knock some doors. That is not what we teach you to do.
Right. Yeah, you don't want to go knock doors. That is for sure. This is a good question here, Patrick. At the end of this is from Alexandria. What if after the demo the doctor does not want to use ABS and already has a web-based system that he is happy with but would like to hire me? How would this work, and would I need to purchase ABS?
Okay, I think what she's asking is if that doctor has another system that's cloud-based and they're happy with it, then could you actually do the billing for the doctor? Absolutely. Now, you'd have to learn their system, but there shouldn't be any problem with that. But you couldn't guarantee the rejection rate less than 2% unless you know what his system gets, which they probably don't have that unless they have, well, we're the only company that we know of that has a built-in clearinghouse, so that makes a huge difference. They might still have 10, 15, 20% rejection rate, even using their own system.
Right. Yeah, and Alexandria, again, I would recommend you seeing the demo of our system, because after you see this and how it's played out, I think we're missing one piece here, Patrick, and that one piece is the practice analysis. Now, I know that we're going to touch on that just real briefly here, but the practice analysis sets up the demo, because the practice analysis will discover where the doctor's already losing money.
Yes, that practice analysis, which we've honed over the last 24 years, is exactly the questions you need to ask to get the information out of the office manager or the doctor, exactly what you need to produce what we call a proposal. In other words, these are templated documents that you just basically drop in your information from your practice analysis, and you go back with that to the doctor and show them, bottom line, that you can either help them or you can't, one or the other. Now, in 99.9% of cases, we can help them because they don't have what we have.
Yeah, you bet. You bet. Let's keep moving on through some of the services because, Patrick, I know that these can be used as part of marketing, as you've clearly have said, and even sometimes in marketing, door openers or ways to engage that office or that office staff or that office manager in some dialogues.
Yeah. Look, if doctors do want to collect from their patients, they could have $50,000 in receivables out there in their AR, and they don't want to go and make phone calls or anything like that. So sometimes they just turn it over to a collection agency. That will turn off patients real fast, and the word of mouth is not worth it. So our system does all this totally automated. Folks, this is an online, completely automated. You don't do anything but push a few buttons, and this will go out and collect the money for the doctor. Now, let me give you an example. Collection agencies only collect about 14% of all the money that doctors are owed. We, through this system, can collect up to 41%.
Yeah,
that's a huge difference. And so we're bringing doctors money that they would not see otherwise without upsetting their patients.
Yeah, you bet. And another way of helping collect some of those accounts receivables is through a service called ChoicePay. And Patrick, now is a wonderful time of the year to prepare for 2019, because we know at the turn of the clock that everybody's deductibles start all over again. And sometimes they're higher, and every year they get higher. And ChoicePay is one of those ways in which the doctors can pay, or the patients can pay this out directly to the doctor without having to go through Care Credit or anything like this. What a great service that the doctors can provide for their patients.
Yeah, and it allows the patient, it's an online cloud-based system that allows the patient to log in and manage their own payments to the doctor. Yeah. It's just the most fantastic way for the doctor to completely forget about the fact that he's got to collect those whatever the patient owes, because this will all do it for them and allow the patient to make their own payments online the way they want to.
You bet. Now, Patrick, I know this is one of the services that you just love because we use it here at the office. Uh-oh, you're muted.
Here's the best way to explain this. Look at the image there on that flyer. Do you see that it shows all those files? You've seen those in doctors' offices, right? Those are patient files. Some of them, though, may be patient files from 3, 4, 5, 10 years ago, right? But the doctor is supposed to keep those on hand. What we do is we can go in and scan all of that into an online HIPAA-compliant document management system called iDocs Now. And we use it here at our office. I have visitors all the time that come to the office, and I say, hey, do you see any file cabinets anywhere? Look around. And they can't find them because we don't have any paper in our office. Right. All that is always scanned into the system. This allows the doctor and his staff, anybody and everybody in the office that has a login, to access all of the documents for all their patients, search for them by any criteria they want, and bring it up on the screen. They can mark it up. They can email it to somebody. They can print it. Anything they need to do is just right there through the system. It is fantastic.
You bet. And one of the last things you're going to learn there during that training workshop is a HIPAA compliance. And HIPAA compliance is so needed in every doctor's office. And Patrick, I know that without really any marketing background or anything else, if people were just to walk in their own doctor's office and ask them, who is the compliancy officer here at my doctor's office, they're going to get a kind of a stare like, what are you talking about?
Yeah. That's a good way to get their attention. We call it a door opener, and you can start with this service. You do make money on this service by putting it into the doctor's office. But once you're in with any of these ancillary services, folks, now you're on the inside. You've gotten past the glass, right? That bulletproof glass that's there inside the office. You can get past that by becoming a partner with the doctor's office in things like Compliancy Guard.
You bet. And then let's keep going on, because Patrick, I know that we've got here just a little less than 15 minutes here, but I've got this picture up here because this is really what you did today. You kind of kicked off the whole marketing campaign of some of the things that you've taught in the past, and then really what's helping licensees get doctors so quickly now.
That almost looks like the shirt and coat that I have on today. I know that was taken a few trainings back. Yes, folks, the marketing training, of course, is a big portion. We take a good full day, literally half of Wednesday, half of Thursday at this point, going through all the different methods that we have found actually work. Now, there's some methods out there that you might think work, like maybe I send out letters to everybody in my Those don't work, folks. We've already tried all those, and all we teach you are the things that have been proven by our licensees to actually work. And we have some tools that Eric's going to show you here where we market those doctors, not just randomly with a shotgun, but we are zeroing in on each doctor and each specialty in a very special way with some of the marketing tools that we have.
Yeah, you bet. And folks, what we're saying here is, what is your target market? A lot of people are asking, aren't doctors already being bought by or going to work for hospitals, or what's happening to them? Folks, what we're seeing now are the doctors that are specialties, your specialist doctors, are still independent. And those providers are using what's called a CMS 1500 form. So any of those doctors can certainly be your target market. But then part of your marketing, Patrick, and now we're kind of sharing a little bit of the secrets behind the curtains here. And really what you're looking for is, you say here, you're looking for power partners who target to your same market. What does that mean?
Well, that means anybody who sells any product or service to a doctor, let's call them a CPA, a banker, a mortgage person, somebody who's a financial planner. They're all actually marketing to doctors, but they're not marketing what you're marketing, right? So we're going to show you how to connect with those people in your community through your warm market, that's the people that you know, and through business networking situations that are out there. So pharmaceutical sales reps, CPAs, attorneys, doctors, bankers, brokerage. Look, he's got it all listed right here. Medical malpractice. We just learned this the other day that there are people out there selling malpractice insurance and disability insurance to doctors, and they make wonderful partners,
right,
to help. So you get referrals from these people once you know exactly how to connect with those people, and they become your marketing arm out there for you.
You're right. And then part of your marketing arm is all the professional marketing material that we have. And that's what we're going to kind of roll into right now, is that we've got everything needed. I know a lot of people say that, well, I think I can go start my own medical billing company all myself. And obviously we know that people can if that's what they want to go do, but they're going to have to develop everything that we already have developed, sometimes spending just as much money and just as much time.
Well, and remember, folks, you can't see these very clearly, but if you zoom in, you see we don't have, American business system is nowhere on any of our marketing materials, because you are the one that's actually out there. You establish your own company. We teach you how to do this. You set up your own company with a name, and you make your own business cards and so forth. And so we print your name and logo on these flyers. We have a printer that digitally prints those with your information on there.
Yeah,
and we spent.
Oh yeah, go ahead,
Erica. We spent over $100,000 having these created, designed, and printed for our licensees, and that's all included, folks. We're not showing you anything today that's extra. When we say that $7,000 license fee covers everything, it's turnkey. You get all this included in it. And now, if you run out of we give you 2,000 flyers, by the way, to start out with. If you run out of them, of course, the reprinting is at our cost, and you do have to pay for those. But I don't know that we have many people reorder these, Eric.
No, because once they get one or two doctors, then the referrals start coming in on top of that. But not only are we positioning you as a subject matter expert, we are partnering with you with a subject matter expert, which is Dr. Vicki Rackner.
Yes, I mentioned earlier that she appears sometimes during the training workshop via GoToMeeting live from her home in Minnesota, by the way. She is a world-renowned doctor who was in practice for many, many years, saw thousands of patients, and then when she retired, she became an entrepreneur, Eric. Just like our licensees want to be their own business, she wanted to start a business helping doctors to thrive in private practice. That's why she partnered with me writing the book you see there on the left, The New Thriving Medical Practice, because folks, doctors are they're very scared right now about their practice. Their cash flow is way down. They're not making near the money that they used to because of all the government rules and regulations. So we're the people on the white horse. You become the person on the white horse to go in and help salvage that. And we partner with you on that book. If you look real carefully at that little image, you'll see that there's somebody's name at the very bottom who's written the foreword. That's your name. Yeah, look real carefully. You'll see, well, it's just a sample. But that's included in your license fee as well. we actually take that name, put your name on the cover. We've already got the forward written, of course. It's just a marketing tool, but your name and company name and website and phone number is all printed inside the book at the end of the forward. So it's like a business card that you use to educate the doctor. We teach you in the class, by the way, how to mark this up a certain way, highlight certain passages, and put some little tabs on there so that you basically, when you give it to the doctor, they're looking at that and going, what is this? And then when they start turning and reading those highlighted passages, they don't have to read the whole book. Nobody reads a book nowadays, do they? Nobody reads it. I don't read a whole book. I skim through the table of contents and read the chapters I want. Well, that's what doctors do, and they love this. Now, I'll give you an example. I interviewed a lady just about, 3 or 4 weeks ago, Jennifer Boyd, and she tells people, I had these printed with my name on them. I gave them to 3 doctors, and all 3 of them are now her clients. So it works. He's a genius. I wish I knew who thought of this. He is a genius.
I wonder if he's on the webinar.
It's one of us. It's one of us that's a genius. I'm not sure which one.
All right. So, but you're in the process of writing another book with Dr. Wachter to do the same exact thing with this particular book, which is a new book that you've got coming out in the next couple of months.
And doctors will eat this one up too. Listen, these are great giveaways, marketing tool, and you can buy these for like our printing costs, which is about $4 a copy.
Yeah.
Shipped. So we're not making any money on these. But that's with your name on the cover. Folks, we ought to be charging $27,000 just to license these books to you, to have your name on there. This one, the doctors will eat up. 9 ways that physicians let money slip through their fingers. They're all interested in that too, because they know they are losing money in their practice. They just know exactly how it works.
I know that if still people are like, I've got a question way down here from Bernadette. She goes, I'm working full time in the medical field, and I'm very familiar with the medical procedures, medical terminology, et cetera. Once certified to work with your system, how long before I see an actual stream of income? And Patrick, that could be within the first 30, 60, 90 days, depending upon, again, it's all dependent upon when the doctor's ready to move forward. Wouldn't you agree to that?
Yes, and some doctors are not ready to move forward at first, but the way we teach you to automatically keep your company name in front of that doctor every single month, it's an automated system. Again, don't do a thing, you just forget it, set it and forget it. They will get cards in the mail from you that reminds them of all the things you can do for them. So if something changes, like the office manager quits or the billing person quits, gets sick for a month, what are they going to do? Their cash flow stops. We're going to keep your name, your company name in front of them so that they call you up and say, hey, I've been getting these cards from you. I've got this situation where now I need you. That's how it works.
You bet. Now, Patrick, I have to say this hour has gone by fast. We've got about 4 minutes left before the top of the hour. But before I know that you have to pull off here pretty quickly, I wanted to wrap up with the one thing about training that I think everybody needs to know, and that is the money back guarantee. You want to kind of talk this through. I know that a lot of people always have a few questions about the money back guarantee. So I'm going to let you take the last few minutes here and just talk this through here.
Yeah, folks, I sat down, this has been 4 or 5 years ago when we came up with this. We didn't have any kind of guarantee, of course. Just like most franchises and business opportunities, they don't have a guarantee of any kind because you might take all the information you have and do it on your own. Well, I sat down and I thought, look, I don't trust anybody, especially on the internet nowadays. And if somebody tells me this is this, and it's too good to be true, I want some reassurance that if I get down there to Dallas and I sit through that class and I go, you know what, this is not at all what you guys told me on the webinar, I want my money back. So I came up with this. Now look, this is in the agreement that you sign when you sign up as a licensee. And there's no weasel words in this. This is straightforward. If at the end of the training workshop, for any reason, you don't think this business is right for you, simply tell any staff member and they'll arrange for you to receive a full refund of your license fee. Now, people ask all the time, are you nuts? How do you do that? Couldn't people just come down, sit through it, take all the notes and go back home and do it on their own? Yes, they could. But very few people over the last 24 years have done that. So that's why we can offer this. We know what we have, folks. And you'll know before the end of the week if this is really something that, like we say it is. And so that's why we do that. Now, That doesn't mean we'll pay for your hotel. That's going to cost you about maybe $700 for the week to stay down here. If you have to fly and pay to get down here or drive, we don't reimburse you for travel or the hotel. But folks, think about it. Let's say you spent $1,000 on all that. That's very little to invest to find out if what we're saying is real.
You bet. Yeah, you bet.
Eric, I'm sorry, but I got to call. I got to get up. So thanks for being here today.
You bet. Thanks so much, Patrick.
I hope to see future training workshops. Thanks again.
Excellent. Thanks, Patrick.